I see we have a few more people coming. I want to make sure that everyone can get into the room before we start. Okay, we're going to go ahead and get started. Welcome, everyone. We're so glad to see you here and for today's session of the Health Speaker Series with PNC in Region 5, the Pacific Northwest Chapter, and NNLM Region 5 have been collaborating on this webinar series for a few years now to highlight topics that we think might be of interest to you. I'm Carolyn Martin, Outreach and Education Coordinator for the network of the National Library of Medicine, Region 5, and I'll be hosting, and with me is my colleague Emily Hamstra, who will be supporting us with technical needs and monitoring the chat. So today we will be learning about a program that focuses on kids with a very fun approach to their health. We just have a few items to cover before we get started. As you've noticed, we've muted everyone as they've joined the webinar, but you are welcome to put your questions and comments into the chat box, which is that little speech bubble that you see at the bottom of your screen. We just ask that you put your questions and comments going out to everyone so that we can all see them. Closed captioning is available on the menu at the bottom of your screen. To view, click on Show Captions icon. And at the end, we will provide you with that information. The session is also eligible for Certified Health Education Specialist, or CHES. Just know that you will need your CHES ID to complete the evaluation. The session C is also eligible towards the Consumer Health Information Specialization, or CHIS, through MLA. Please keep in mind that we would appreciate you taking the evaluation whether you want that CE or not. So today we have Dr. Mary Rose Dela Cruz, whose research is rooted in community-based participatory research, and her interests involve tobacco and underage drinking prevention, providing appropriate community health materials, and improving health outcomes of Filipinos. She is the Director of Community Health Research at the Hawaii Public Health Institute and is an Associate Researcher at the University of Hawaii's Department of Public Health Sciences. So welcome, Dr. Dela Cruz. And I have to say, as much as I wish I were with you in Hawaii, we are also glad that you are here with us virtually. So I'm going to go ahead and let you share your slides with us.
Can you see my slide?
Yes, we can see your slides.
Oh, great. Thank you. Thank you, Carolyn, for that wonderful introduction. Big thanks also to Emily. Good morning, good afternoon, or good evening, wherever you may be. And thank you to everyone for being here and listening to my talk. I would like to begin by acknowledging that the Aina on where I am, the Ahupua'a of Nu'uanu in the Mokokona on the island of Oahu, is part of the larger territory recognized by the indigenous Hawaiians as their ancestral grandmother, Papahanaumoku. I recognize that each moment I am in Hawaii, she nourishes me and gives me. I further recognize that generations of indigenous Hawaiians and their knowledge systems shaped Hawaii in sustainable ways that allow me to enjoy these gifts today. For this, I am grateful, and as a settler and immigrant, I seek to support the varied strategies that the indigenous peoples, Kanaka Maoli of Hawaii, are using to protect their land and their communities. And I commit to dedicating time and resources to working in solidarity. Mahalo and salamat. And thank you for being here. This is the agenda and the learning objectives for today. I'm going to talk a little bit about my background of Keiki heroes. They were born from the pandemic, and I'll also share what has happened since then. But we love Keiki Heroes and how we address public health topics through this mechanism and this material. We have a current edition that focuses on eye health and funded by NNLM. The learning objectives for today is to describe how to partner with community organizations to create a health education material for children, identify the process to translate health materials and create them to be culturally appropriate, and describe ways the health materials could be utilized in different community settings. I wanted to talk a little bit about my background. Like I mentioned, I'm an immigrant. In the picture that you see, the gentleman hunched over planting pineapples is my dad. So he came to Hawaii because he was a pineapple planter. So I grew up here and I still keep my language. I'm first generation, and I'm also English is my fourth language. And so I totally relate to those who are non-English speakers. It took me a while to learn English. So that's why this is more near and dear to my heart about providing good health literacy and culturally appropriate materials for our populations. I am with the University of Hawaii. I wear two hats. I'm a researcher there and a researcher at Hawaii Public Health Institute. I have been making materials for over 20 years. The picture that you see in the middle, that's named I Decide, is an organ donor program that we tried to incorporate at some high schools in Hawaii. While you're a teenager, you would want to get your driver's license. And during this time, we also were encouraging them to put organ donor on their driver's license and informing them through videos and social media and also materials on why this is important, especially since Native Hawaiians, Pacific Islanders, and Filipinos are high in the kidney dialysis and kidney donation list. A lot of my research is out in the community, and that's the picture that you see on the right. Though I'm in the university, I like going out to talk about research because a lot of the research involves and relate and impacts the community. So we bring our research out to a community, and that's what you see is a community meeting with researchers and community members out in the field in Waianae, Hawaii. The picture that you see in the bottom is another event with caregivers. It was a caregivers appreciation event. And not only did we talk about data with the caregivers, but policies that they wanted to fulfill during the legislative session, but we also collected data through interviews and focus groups and asking them about their main concerns. So that was in the heart of Kalihi with caregivers, providers, and public health advocates. So I do love our communities here in Hawaii. Even though we have many islands, we try to go out and get the pulse and understand what kind of materials they need, but also what kind of research they would like to see in their community and involve them. I started off at the UH Cancer Center, where I learned through the I Decide project to make materials, but I truly learned about community-based participatory research and developing materials that were culturally based and appropriate and community accepted. It was a U54 grant with NIH and CI, and we worked with a lot of Native Hawaiian, Pacific Islander, and Filipino organizations to develop pre-tests and distribute cancer prevention materials in Hawaii. It is guided by our CBPR, Community-Based Participatory Research principles. And we really, and to this day, I strive to develop culturally appropriate products for cancer education and research for our populations in Hawaii. So just a few, I helped create or pushed out or revised 150 materials that are cancer prevention, tobacco prevention, alcohol prevention. But these are some of the materials. For adults, we created, they like seeing actual pictures of community members that are represented for the brochure. So we have an item here in Marshallese. We also created materials on breast cancer, colorectal cancer screening, oral cancers, and we also make diabetes materials. This you will see in every clinic, and also sometimes you'll see it at the airport to educate our populations on diabetes, also heart attacks and strokes. So I've based a lot of my education and my training through the work I've done at Amy Hawley Native Hawaiian Cancer Network. I'm currently also at Hawaii Public Health Institute. It's the only public health institute in Hawaii, and our mission is to advance health and wellness of the people here in Hawaii. We do have many programs that look at embracing social, cultural, and environmental factors. We work with our healthcare systems and our fellow community-based organizations looking at education, advocacy, research, and training. So we have a lot of policy work, environmental work, education, research, to look at the environments that people live, learn, work, age, and play here in Hawaii. When I talk about Keiki Heroes, I do want to say where it was born from, and it was made because of the pandemic. During the pandemic, Hawaii's Native Hawaiian, Pacific Islander, and Filipino communities were disproportionately affected, and we had consistently the highest rates of COVID-19 cases, mortality, and hospitalizations. Still this day, Filipinos are still #1 in death rates and hospitalizations, and we continue to push forward with more information. But because of the pandemic, we wanted to also educate our youth. There were a lot of quarantine time, and people were isolated or going back to school, and children did not know about masking or social distancing, or even about vaccination and shots. So Keiki Heroes were created. Keiki means child in Hawaiian. Currently, Keiki Heroes makes materials, health education materials that are culturally appropriate and age appropriate, and we support physical, mental, emotional, and social health of children here in Hawaii. And we believe our Keiki are our heroes, they're our future, but we also wanted to have some models to show good, healthy habits. And Keiki Heroes became a part of the Hawaii Public Health Institute in 2022. So please let me introduce our Keiki Heroes. This is Kai and Hoku. They're adorable mascots. They were created by Yuko Green, who is a Hawaii children book author and illustrator, very wonderful. She has many, many books here in Hawaii. Kai and Hoku are cousins, and they're also best friends, and they're from the Big Island. And during the early inception of Keiki Heroes, they promoted hand washing, social distancing, and masking. But now they also promote eating healthy, wearing glasses, and other positive health behaviors. So let me talk a little bit more about the origin story of Kai and Hoku and Keiki Heroes. So at the end of the 2020 school year, things changed, of course, for us here in Hawaii, but also nationally and globally. Kai and Hoku were supposed to visit their cousin during their spring break, but the trip was canceled because of COVID. It was hard for them to understand what was going on. His families were worried and started to talk about the coronavirus. So they questioned, what was this new coronavirus, and why did it mean they couldn't do their normal things that they love, like visiting each other, seeing their tutu or their grandmother, and going to school. So one day, Hoku's mom gave her a mask to wear when they went to the store. Once Hoku put the mask on, she became a Keiki hero. The mask gave her the power to protect herself, family, and friends from the coronavirus. She was excited about her new powers and had to share it with her best friend and cousin Kai, so she asked her mom to help her find a mask for him too. They dropped off the mask at Kai's home, and once he put it on, he also became a Keiki hero. Together, Kai and Hoku are now Keiki heroes. Their mission was to help Keiki protect themselves, their ohana, their family, and all their friends and teachers. So during the pandemic, we made a series of Keiki hero materials, and we translate into 20 languages that we worked with the Department of Health here in Hawaii. And during the pandemic, we disseminated 25,000 materials, hard copies, through our partners. And we also really pushed it out in our Instagram, website, TikTok, Twitter, I think. And in a single day, we had 6,000 people engage with us through social media. We have books and stickers that we distributed through churches, schools, parks, and farmers market through our 15 partner community-based organizations. And they still ask for the materials and we still disseminate them. So I just want to show you a few examples of the Keiki Heroes that were distributed during the pandemic. As you can see, we have here pictures about social distancing and staying in the bubble, respect the bubble, wearing a mask. They could also color it. And then what you see here is a Tagalog version that we translated. And here's a Japanese version on the right, showing what it looks like when you visit a clinic to get vaccinated. So during the pandemic, Keiki Heroes had, we'd like to see a big impact. There was utilizations of the materials at vaccination and COVID testing sites. So while the parents or the adults were getting vaccinated, they would have the Keiki Heroes books out with the crayons and pens, and the children would wait while their parents were getting vaccinated, or they were waiting for their turn to get vaccinated. And when they did, we also gave them some stickers to put on. They were really big stickers, and they were so happy to have some. We also disseminated in schools, integrated mobile clinics across the state through our partners with Project Vision and Healthy Mothers, Healthy Babies. It became a teaching tool, I found out, for high school students learning another language. Because we offered it in 20 languages, the teachers were using it for teaching them about Marshallese and the Filipino languages. We increased our partner collaboration, and we had support from over 30 partners who were distributing the materials. We had a huge grant from CDC that helped us mitigate and mobilize to 11 and partner with 11 community-based organizations and 7 community health centers. And this is, I just wanted to show you this map because we went across the state in different community serving organizations, whether they were Pacific Islanders or Hawaiians or Filipinos, but also the community health centers here. And I do want to highlight one with Project Vision Hawaii, who became our partner for this current edition, focusing on eye health. But I do want to mention, please visit keikiheroes.org. If you can also Google Keiki Heroes and it'll pop up. It's free and downloadable. You can print them out. That's the best way, I think. You can make it small or big. You can make 500 or 5. We have over 150 products in there, whether they're activity books or sticker sheets. And if you need hard copies, you can request. We have limited availability, and also we have limited postage. So, but we do offer this to some of our community organizations here in Hawaii. The picture you see is Foods of Hawaii. We partnered with Food Basket, and we've created a really awesome and wonderful coloring book for them to color different fruits and vegetables here in Hawaii. And we also offered, so that version was the wet version. There's different fruits and vegetables here in Hawaii. And during the summer, from May to October is our hot season. So we have mangoes and tomatoes. So we talk a little bit more about that. And we also have recipes in there. Our current one here is for a Spanish version. So the Spanish community wanted their own version. So we have Spanish in Spanish, but we have specific recipes in there for our Spanish community, especially in Maui. We did a physical activity one where we encouraged them to ride the bike, walk to school, or ride the bus. And we have an emotional I am feeling sheet for parents and the children to talk about feelings. During the 2023, we suffered a heavy environmental catastrophe at Lahaina, where they had the Lahaina fires. So as 50% of Lahaina are Filipinos, so we did have did partner for a Hawaii Filipino resource fair, and we were in charge of the kids while the parents were getting services, filling out unemployment forms. So we had our Keiki Heroes coloring books in Ilocano and Tagalog, and had Play-Doh, all these games, and we interacted with the children so that they could take the Keiki Heroes books home, but also help them as they were going through the grieving process also. So there's many ways I wanted to show how we also utilize the books. Now I'm going to talk about the current edition. Because of our great partnership with Project Vision and our long partnership with them, we decided to also work on the current edition on eye health. Project Vision, or PV, is a community-based organization, and they do mobile health screening visits across the state, whether it's tobacco cessation, they have their vision machines, but they also provide social workers. And we had a lot of discussions during the pandemic about an eye health version. And we love the relationship, and we thought, like, because there's a lacking of materials for children, this would be a great partnership. And I do want to mahalo and thank NNLM and NIH, and especially the staff of the University of Washington, Emily, who's been really helpful through this process for funding the eye health edition of Keiki Hero. So thank you so much. So this is the eye health version of Keiki Heroes with Project Vision. We had many meanings about this, what the storyboard would look like. We learned a lot about what the mobile clinic did and what kind of items they really wanted us to share with in the book. So we do have a lot of activities and games that the children could look at. It was very limited to the coloring portions and activity portions. So we had 6 pages, but we did, again, work with our illustrator, Yuko Green, and we worked with Filipino translator, Ms. Clemen Montero, who translated in Ilocano and Tagalog, because they are the most in need of eye health information, along with the Marshallese population. So Project Vision provide the Marshallese translation, and we will disseminate once they print out the hard copies for the Marshallese edition. And then we were such a great partner that we know there were changes in 2025. So when fundings were halted, we communicated, but we really wanted to push through and finish it up. So we worked it out, and we got it printed and also disseminated in a timely way. But we also appreciate the open communications with University of Washington regarding funding. I do want to share just a few pages here about Keiki Heroes, the eye health edition. And so the storyboard is, it's a baseball game that Kai and Hoko attends, and their cousin is a baseball player. And it shows like he showing off his sports goggles because it's prescription and it helps him play well. But Tutu here, grandma says, "Oh, I can't see anything." And her daughter says, "Oh, don't worry, Tutu, we're gonna take you to your eye exam to get your eyes checked." And Kai and Hoku's cousin hits a home run, but an outfielder, home run, hits the ball, and an outfielder couldn't see because he wasn't wearing sunglasses. So the coach is saying, like, maybe these will help. And then, so that was a storyboard that we agreed on, and we also have activity spirit there, but we also like to feature a pledge here in the back of the book to talk about, so parents can talk about and agree to with the child, like eating healthy, wearing sunglasses, wearing glasses and whatnot. So it gives them a proactive way of deciding how they could take control of their eye health. So there's 6 pages to color, and then play games, and also sign a pledge. So the dissemination and next steps here, I'll go over a little bit, but I also want to show you, this is one of the activities and one of the pages where they decode the puzzle and also color in their glasses. But our next steps was to provide English, Ilocano, and Tagalog copies to Project Vision Hawaii, and they received it and they'll disseminate it. And we're hoping to print the Marshallese copies soon, and we'll share with Hi-Fi and all our partners. Project Vision also has their Better Vision for Keiki program, where they have 20,000 students in Title I schools and charter schools, and they're hoping to disseminate the materials there and talk to youth about their eye health. So this actually supplements what they're saying and their procedures. And we've already disseminated many of the materials to our neighbor island Hawaii Public Health coordinators. And if you go onto the website and you click on the eye health edition, we also continue to promote medlineplus.gov in addition to the books. And we're also preparing social media posts to promote the books. We have a high social media following, and we love featuring Keiki heroes once in a while, especially regarding vaccination and eating healthy, but we'd also want to promote the eye health books. And that is it. Thank you so much for your time and for listening. Please reach out to me if you have any questions regarding Keiki Heroes. And this is my contact information, and the slides will also be provided later, but I'm going to stop sharing for questions, and I know Carolyn has additional information.
Thank you, Dr. Dela Cruz, for this great presentation. And again, feel free to put your questions and comments in the chat and make sure they go to everyone so we can all see them. But as you're thinking about your question, I have a question for Dr. Dela Cruz. You mentioned you have multiple language options for these materials, and I know that this can be quite a challenge for organizations, and I was wondering if you had any tips or about how to provide quality translations for materials.
Thanks, Carolyn, for that question. Yes, it is very difficult, especially translating 20 different languages, but also having them be appropriate for the material. So, of course, you don't want it to be too complex. You want it to hit the right literacy level. So during COVID-19, the pandemic, we had this grant where we did partner with the Pacific Gateway Center here in Hawaii, and they had the capacity to translate, and we worked with them. And we also had community translators where we have stringent translating processes. So I think it helps to have someone who understand the translation process, the first translation, the back translation, and an adjudicator. So you actually need 3 people to review a material to make sure they're, especially if it's a health material, that there's some, the right medical jargon, the right medical information, but also not making it so that it's not comprehensible. So it's a lot of moving parts, and it takes a long, lengthy time. I do not encourage to give it to your cousin to translate. There is a long process, and we're so grateful that we have a lot of partners that we've learned and worked with through the years, and it changes all the time. But we know who to go to when it's specific to Japanese, when it's specific to Hawaiian or Japanese. Sometimes it can't be all at one organization, so we do have contracts out. But you do want to make sure that, and we hear it too, like when we do make materials there, they say like, oh, this is not translated correctly, and we understand that too. Sometimes we don't capture the exact nuances, and there's different slangs, and there's conversational styles too. So, but we want to push forward the best translation you can have. Our communities need the best information out there for them to understand screenings and information. So work on looking at different organizations locally, and for those who already make health materials, find them and ask them their process. I'm really transparent about our process here at Hi-Fi, and the process I've done with Imihale and also through the university.
Thank you. That was very helpful. Emily, did we have some other questions in the chat? I remember seeing a few here.
Yeah, there's one, Rose, just when you started talking about Keiki Heroes, someone asked in the chat what grade level those booklets are written for.
Yes, um, we made them so, we had toddlers coloring them for during the pandemic. It's just a coloring book, but we made it so that it doesn't go over fourth grade level. We made so that we followed I'm trained under the class guidelines, and I understand the literacy level. So that's what we try to do. Even our adult materials that I create, we try not to go over the high school level or even sixth grade level. But this is made intentionally for children up to fourth grade. But like I mentioned, the high schoolers love them. They're learning different languages too. So it's really, they could relate also.
I think that's a good point to make. The different grade level of content can appeal to a wide range of ages. So thank you.
Oh, I see a chat question from George. Do you get input from community members into the content? Also, how did you decide on which health issues to cover? Yes. I like I mentioned, I was trained. I'm also a researcher. I do policy and I also make education materials. I call them the trifecta. If you want behavior change, you need all three. But I make materials, I always have an advisory board or advisors, especially those from the community. People always ask me, why don't you just automatically translate this in Tagalog or translate it in Japanese? And I always say, because the community might not be ready for it. No sense you make something and they're not going to utilize it. That's a lot of effort, a lot of time, and a lot of money that you're pushing forward. So we always wait for a community. We have champions and stakeholders to say we're ready for a Marshallese version on breast health now, Rose. So that's when we start making them and translating them, and also going to our community members who are Marshallese or Filipino and say, can you look at this? So it actually takes me a year. Sometimes I'm in the airport and I call it my road show, right? And I'm like, can you look at this material and let me know what you think about it? And some of them are really honest, like, this is ugly, or you shouldn't put this picture. Same thing with Keiki Heroes. It was Project Vision who came to us and said there's not a material for our children. And we go to all these schools across the state. We hit about 20,000 students to look at their eyes and check with their parents if they've got their eyes checked, but we don't have any materials for them. Can you make a Keiki Heroes version or coloring book? And we do that. Our next iteration, our next edition would be on oral health. So we're gonna look at having Kai and Hoku talk about flossing and brushing their teeth and eating the right food so that their teeth are healthy. So, but everything's timely. So we're just looking for funding and the coalition members to also support that, even our dentists community, to get their feedback before we start producing them. So it's a long process, many, many drafts, up to 10 drafts, and then do it again after you get a mock-up. But we have such great community members that know to help us out when we want them to look at things. So just having the right people and know who to talk to. We love new community members to give us feedback. Or even when there's changes and recommendations regarding vaccinations, regarding what you eat, we try to update our materials to and print out new ones. Like I mentioned, the community needs the best information and the most up-to-date. So we try to do that too.
We have one from Francis that says, How were the high school students used? Did they write the content, the translation?
Yeah, so I was at a conference, a local conference, and I was holding my Keiki Heroes book. And someone who was sitting next to me from one of the high schools, I've never met her before. She's like, "Oh, I have so many of these, and I use it to teach my to teach my students Marshallese language." And she also taught Ilocano. And she's like, "I use this all the time. It's really because of the basic it's basic and it's literacy, and they could draw and color, and then they love it that it's local and it's made from a local entity here in Hawaii." So that's how I found out. But then I also found out that, you can find them in libraries, you can find them in clinics. So yeah, I mean, I don't think high schoolers, I have a high schooler myself, and she was like, "Mom, because I tell her, hey, would you use this coloring book?" She's like, "No, we don't color, Mom, we draw." And so I think it's more relevant to our elementary school students, but learning a new language in 7 pages that'll support and also talk about public health, I think it's really helpful for our high school students to engage and to have those conversations. Thanks for that question.
And I wanted to also mention that somebody mentioned that they love the roadshow concept that you talked about. I like it too as well. So another question we have is, thank you for sharing and presenting. Just curious, so far it looks like it's covering physical health, which is all great, but are there thoughts to expanding to mental health topics as well? They are referring to the fact that the Seeing Sesame Street is addressing this topic.
Yes, great question. So I think I showed that picture of the different emotions, and even that was a little bit difficult because we also had some Hawaiian words in there, and it's there's sometimes you have 5 Hawaiian words for one emotion, and so picking the right one, but also having the right affect shown through a cartoon. So that was really interesting, and we have numerous discussions about mental health, and we are still debating about what is the best way to address that. When the Lahaina fires came up, and we had Keiki Heroes, and we brought it as a resource to I think it was like 6,000 people there. It was just a coloring tool in their language, and it helped to distract the children, and to help the children to normalize something while their parents were seeking services. And during that time, someone says, like, "You should have something about the fires in a coloring book." And I'm like, "No, I mean, that is not why they're gonna use a coloring book for, and we don't want to re-traumatize them by having a coloring book on fires." So we are delicately looking into mental health. I always, as a researcher, and I do a lot of research as substance use and cancer prevention, it's already hard reaching and talking to adults about mental health. I can only imagine how to do it appropriately for children. And so we are thinking about it a little bit more and getting information, getting more research, having a lot more discussions about it, because we want to do it appropriately, and having the children engage, but also being sensitive to the parents' needs. Like, imagine having these coloring books out at schools or churches, and you're talking about mental health, and the parents are not ready to have that conversation with their child. So we're getting the temperature check from our community members too, and having the right advisors for if we do plan to do a mental health edition, what's the appropriate way, and are the different communities okay to translate it? I mean, have a translated version. So we come across that every single edition, every single year, on what is the best way to do it. And maybe there'll be a ready time, like we all know. But I think we are still in the midst of discussing that. But that's a great question.
I think we appreciate the time and the thoughtful process that is being applied to this because that is a sensitive topic that really should be explored. But I also think it's great that you guys are focusing on topics that I think are often not considered, like the eye health and oral health. I think those are two really great topics. Um, let's see. Are you working with public schools or school health programs?
We do through our partners who are already in the schools, we use them as the mechanism and the avenue. They're a lot more effective and integrated in the school systems than we are at Hawaii Public Health Institute. And so we work with them through that way. And of course, we do have hi-fi coordinators across the state. So when they do visit schools, they offer Keiki Heroes or other materials we have. We have so many. We have on tobacco prevention, cessation materials and resources. But we try to go through our partners so that it becomes a supplement to their outreach. It's hard to just push, and I know this as a health educator and as a maker of materials, it's hard to push a material and because you don't know where it goes, right? It might just go in their purse or their under, it's in the bird cage, like with the newspaper. So you want to make sure that there's someone is talking. There's a warm handoff, like talking about the material so that there's something that it could be attached to instead of just, because it's expensive to make materials. But at the same time, we also talk with our providers and say like, hey, we have a material when you talk about vaccination or when you talk about nutrition, when you talk about it, could you have them look over this brochure, and then we make it so that the patients and the consumers can write on them and bring it home to their tutu or to their child to also have a follow-up discussion at home. So we like the utilization and the utility of the materials is important for us instead of just giving it out at a health fair. I don't think that's the best way, but there should be some education and outreach attached to it. So we offer trainings and we offer webinars like this and educational options. When we push out a material, we'll say, this is when you get our material, please hit these key points so that they know what to say and know what page to highlight.
I see someone mentioned that the Hawaii State Public Library System has a Keiki self-care toolkits to support families, and they've included some links there, and that they have been partnered with or would love to expand and seek ideas from others, and that there's one about Mental Health America that has partnered with them as well. Another question is, what results have you seen from disseminating this health information, or how do you measure results?
Well, that's a $1 million question, huh? I'm a researcher. I'm all about the data, and I'm a prevention researcher. So, it's hard to measure results when the end result is health, right? When no one has cancer because of a material that you've created, that's the dilemma that we usually have as prevention researchers. But anyway, what results have you seen from it? So of course there's numbers. Whenever someone downloads our materials, when someone asks for it, when we keep those, we track that. I run out of materials, and I love that I do because that tells me there's a need for them. I don't just push them out. Our partners tell us, like, Rose, I need 500 more. I give it to them. I would hold just 10 just for prosperity, right? And for a record, but no one should sit on materials. If you're sitting on materials, it's not being utilized. So I'm glad that I run out of materials. And that's another way of it to show us that it's being utilized and it's being read. Um, so that's another measurement. I do like going out to communities and then they hear like, oh, I've seen these Keiki Heroes before materials or have you heard of Keiki Heroes? So even our partners will tell us like when there's new materials out and we actually keep our partners' materials here at Hi-Fi too, so we can also support them. But a lot of it is social media, our social media numbers, how many we get out, website numbers, how many downloads. Um, and our coalition members. So if our eye health partners are saying like our coalition members are utilizing it for the oral health, we're hoping like dentists will have it in their clinics. All our vaccination uh, additions, are in the clinics and whatnot. And they will tell us if they need more materials. But having an empty shelf is my measurement too. And I'm glad to see that they're being utilized and in children's hands and parents' hands.
Do we have any more questions or comments? And I'm going to go ahead and soon tell you about the evaluation and how you can get your CE, but just we do have a little bit more time. Well, just we will go ahead and wrap up with the evaluation, but there will be still a little bit of time if you wanted to put another question or comment in the chat. So we want to thank you, Dr. Dela Cruz, and I'm sure our audience has been very engaged with your presentation with all these questions and comments. We do want to put I see Emily put the link to the evaluation in there to get your CE credit. Don't worry, if you're not a member of the Medical Library Association, you can still get a certificate by completing the survey and answering that you want the MLA CE, and more information will be provided. So look at that carefully to make sure you've got all the information you need. And if you are a certified health education specialist attendee, please complete the evaluation and register your attendance and receive a certificate. And again, you will need your CHESS ID number to complete that evaluation. And before I mention the next session, I just they'd be appropriate to use on the mainland.
Oh, yes. Yes, we do have a lot of the populations, this is mostly geared for our populations here in Hawaii, but we do, it's made for everyone, really. But we do have kai and hoku, and there are people are like, what is kai and hoku? I mean, those are Hawaiian words. It means sea and star. But we do have a lot of Hawaiian words in there. But we have Hawaiians, Pacific Islanders, Filipinos, Asians across the nation, and we heard that's been utilized there, especially with communities that have high rates of people of color. The intent was to also share it out, and hopefully NNLM will also share it to communities that have high rates of or high numbers of Filipinos, Asians, Native Hawaiian and Pacific Islanders in the libraries. And I've seen my materials go globally too. So since it's downloadable, anybody has access to them. And hopefully they'll be utilized too.
Yes, we'll be looking for your social media images that we can also use to share on our social media. And I see that someone mentioned Kai is a very popular name in California. So we have a very global world. So people move around a lot. So thank you. This and the materials are from Hawaii Public State Library System are fantastic, someone says. And thank you for following Keiki Heroes. Oh, she just followed a Keiki Heroes on Instagram. So you're already getting some
Oh,
traction
great.
there.
Thank you so much. Yes.
Thank you.
Also, we feature Keiki Heroes on Hawaii Public Health Institute. It's our account is at Hub for Health. So there's a lot of up-to-date items there, and we feature Keiki Heroes and all our different populations. And I'm trying to hit the right literacy levels to get the right information out there on our handle. So thank you so much. And yeah, please let me know. I do have a lot of different materials also made for different populations that I've tested. And I call them my children. It's hard to get the children out and also educate. They're also my Keiki heroes, these materials, because people often say, like, in this digital world, why do you still make hard copies? And I say, in Hawaii, we're very collectivistic and we have multi-generational homes. So a lot of times they like to bring it home and share it with their family members. And there's applicability and utilization that with providers writing on them and circling them. Something to look at, something tangible. Not all of our populations and communities have internet access. So this is really helpful for them. So it is relevant. No one has told me, like, I'm not going to use this ever. I'm so glad that the materials are still being used, the paper, the hard copies. I love them. I do the roadshow. I feel like a Mary Kay consultant sometimes. When you open my trunk, there's all of these materials. So I'm glad to always share them out. Thank you so
And
much, everyone.
I think this would be a great resource for many libraries and organizations to have on hand in their spaces. So make available. So thank you for making those available. I see someone asked about having their own hard copy. I would think that they can just contact Keiki
Mhm.
Heroes or yourself to inquire about that.
Yes, of course. Please let me know.
Well, I think we've pretty much, let's see. Oh, we have another question here before we go. Do you have any resources for kids helping prepare for disaster or everyday emergencies? And May
During the
Rose,
Lahaina, yeah, during the Lahaina fires, that came up too. And like I mentioned, we do have fire safety and what coloring books that our fire department here. And I'm sure they do it nationally to push out in the schools. And they do such a great job, and we don't want to duplicate that or um, overshadow their work also. But I think that has come up so many times about disaster preparedness and preparing. And hopefully, I don't know if it's going to be a coloring book and whatnot, but also my other research project I have is on drowning prevention. So that might also be another topic we're looking at. But um, once we get more and more information and how, the stars have to align, funding, having the right advisors, getting the right translators, and also having the right content. Once all we have all that, then maybe it's the best time to make an addition. And also having the right coalitions and community members to push it out. So if there's more, if there's will to make that material, we'll definitely look into it and looking at disaster preparedness. Thank you for that question.
and May Rose also has her email in there for you to contact her. I also want to mention that we do have another session scheduled for February 25th. It is about supporting families experiencing the effects of wildfire smoke, and you can go ahead and register to attend that. You can also visit our webinar series webpage to view the recordings of past sessions and to register for the upcoming sessions as they are available. And we hope to have this recording available soon. It might be a few days or a week or two before we have it available, and we appreciate your patience during that wait time. It will be available on our YouTube channel, but it's also on that registration page that where you signed up to attend this particular session. And we'll also have the presentation slides available there as well, but just give us a couple more days to get those there. So thank you again. Dr. Dela Cruz, we really really appreciate you taking the time to come and present about this. It was such a joy to see something very positive about health and to focus on children, and that it's been much appreciated. And thank you all for coming and taking the time out of your busy schedules to attend this session, and we hope to see you again in a future webinar. Thank you all.
Thank you. Aloha.